Is the next patient age 31? একদম সেরে গেছে. He has a rectal fistula with burning and discharge of pus, which is quite bad smelling. He has premature ejaculations as well. 31. Those were his two major problems. Other than that, it was absolutely fine. His generals, he is chilly. He likes sweet and salty. There's a history of excessive masturbation. Fistula কত বছর ধরে ছিল? He came to us in July 2019. The fistula had been there since March 2018. Earlier, sometimes there used to be bleeding with the pus as well. He had been to other homeopaths. He didn't go for conventional treatment. He had been to other homeopaths who had prescribed hypersulf, who had prescribed silica, sulfur, mercury, and nitric acid. Obviously, these were the names just from the prescription. We didn't know in what dosage, in what way. So we just got the prescriptions, right? My friends, again, whenever you have cases of any pus, any suppuration, right? You may not have fistula in your part of the world, right? But I'm sure you'll come across cases where there is pus formation. It may be in the gums. It may be a case of pus with acne, right? So wherever there is pus formation and it's recurrent, it gets better, you're prescribing remedies, it's coming back, right? Please try staphylococcine. Have you shared this medicine with you? Superb medicine for recurrent pus. It could be a recurrent pus with acne. So you think of acne with there is pus formation. You're prescribing a sulfur. You're prescribing your regular suppurative medicines. You understand what I mean by regular suppurative medicine? Silica, hyper, merc. It's still coming back, right? Think of a recurrent gum abscess with pus.
So is this a syphilitic pus or is it like the discharge?
No, it's a syphilitic pus. Yes, it's a pus. It's not a discharge. Good question. It's more like a pus, right? And pus, you understand, is syphilitic, right? So recurrent gum abscess, where it pus gets better, is coming back, gets better, is coming back. Think of a rectal fistula where you have a pus. দেখানোর মতো নেই তো যে ফুটো আছে এখন রস আসছে ওর সামনে ঠিক আছে তো আর দাঁড়া so recurrent fistulas with pus, recurrent boils where there is pus formation. You understand, you're prescribing sulfur, it's coming back, sulfur coming back. Please do try staphylococcine. It's a superb medicine. You may have patients coming to you who have taken these medicines from other homeopaths. B, you may have prescribed yourself where you have given, Ruben? Tonsils? No, that's not so much helpful. These are the 4 areas where staphylococcine works really well. Staphylococcine was prescribed in 200C. So please put this in your clinical tips. Recurrent suppuration, your well-selected medicine fails, do try staphylococcine. If you have this same recurrent pus, but you have very high fever with it, think of this medicine, pyrogen. You understand what I mean? Staphylococcine is a recurrent suppuration, but there is no febrile changes, there is no fever in staphylococcine. But think of a same person who's having a recurrent pus and there is 104 Fahrenheit temperature. You'll think of pyrogen. Pyrogen is also a medicine for recurrent pus, but the differentiating factor, here you don't have fever, here you have a high temperature. You with me? Please do try staphylococcine. In the handout we sent you last week of the nosodes, you have staphylococcine in that list. It works brilliant. You have had massive success with staphylococine in well-selected medicines fails, right? দেখাও তো একটু এখানটা কোথায় শুতে পারবে she likes to show the fistula
No discharge. Seems like no discharge.
any lesion is there or no কোথা দিয়ে রসটা আসতো আঙুল দিয়ে দেখাও
It could be the exit of the fistula.
okay he's showing the point where this to be the discharge
Yeah.
ঠিক আছে উঠে পড়ো থ্যাংক ইউ
ফার্স্ট টাইম এটা ফুলে যেত ফুলে বড় হয়ে যেত আবার বেরিয়ে যেত
he's saying it used to swell up and there used to be pus coming out from that. It's Ruben saw that as well. It's dry, absolutely right. 1 dose of staphylococine, nothing else. July 2019, done. Just 200C. 1 dose, 200, July 2019. We are boosted. Even the sexual has improved. If you look in any Metromedica for staphylococine, there is no mention of any sexual symptoms, right? But you understand his fistula was such a concern, probably because of that pathology, his sexual drive was turning low, he was having premature ejaculation. Now it has dried up, he's telling his libido is good, premature ejaculation is reduced as well. So staphylococine has taken care of both, right? Jala tala gulo burning, nahi to? Burning is much better, little bit there, he's saying, discharge ekdom asheni, rosh tosh kichu nei. Discharge is absolutely gone. 1 dose, 200C, July. I saw him in August. He stopped treatment. Thought he's got completely better. Little bit came back, but there was not much in December. But I waited. He was doing all right. I boosted in December as well. He came back in February today. Please do put staphylococine in your notes. It's a one medicine. We have shared with you streptococcine last week. Staphylococine is this another fantastic medicine. Put in your notes. Wherever you have hipersal, wherever you have silica, wherever you have mercury. If you're using those medicines, you'll definitely find avenues for using staphylococine. You understand? That's, as I've shared with you last week as well, you have to incorporate these medicines into your practice by remembering it with medicines you use so often. Right?
So hipersol, mercury, and
Silica. And he got those medicines, right? You heard, maybe not in the proper dispensing way, but he got a dose definitely of those medicines. Didn't work. Recurrent sore throat is streptococcine, but even if there was pus, I won't think of staphylococine. Staphylococine is more like a skin or dental pathology with pus. Streptococcine is congestive pathology, so there is a lot of redness. So Belladonna, streptococcine, that's why they follow each other. Right? Yes. You understood the question from Martin? If it was tonsils with pus, I won't think of staphylococine. Staphylococine weak areas are this: skin, dental, skin. So you understand, this is the definitive action area for staphylococine. You understand what I mean? Right? She asked if streptococcine would be the ideal medicine. I said no. Streptococcine is a medicine for congestive tonsillitis. So it turns red, there is a high fever, but not with pus formation. Right? Whereas pyrogen, you can prescribe it for any pus formation, but there has to be a fever in pyrogen. You understand the name of the medicine is pyrogen. Pyrogen comes from the word pyrexia, fever. Right? So you have to have a high fever for making a pyrogen prescription. You have any of these, but there is high rise of temperature, don't prescribe staphylococine, go for pyrogen in those cases. You understand, he's doing much better. Generally with fistula, if they're forthcoming, we see the lesion. If there is it has dried up, there's no discharge, that's also a sign of improvement if it's not coming back. Right? We're boosting today. Take it. Thank you.